Hello and welcome to The Source, everyone, where we use data and technology to drive healthcare innovation. So today we're going to be highlighting solutions that help leverage data for improving quality management. And we have three Arcadians with us, Josh, Candace, and Christine. Let's go ahead and get started with question 1. What are some of the most pressing challenges healthcare leaders face today in managing quality, performance, and costs? And also, what are real-life implications of said challenges on patient safety and care?
So I think one of the most consistent challenges that I see across the range of leaders that I talk to who are trying to manage quality performance are concerns related to data timeliness and trust in the data, right? Those two things really matter and often cause them a lot of pain as they try to operationalize quality improvement programs throughout the year. And the questions that I regularly hear them considering are, does this data point paint an accurate picture of the reality today, or is it stale? And are we really capturing everything that we should be? There's one particular organization that I'm thinking about that, as part of their core strategy for quality, made a sizable investment in a care coordination team. The challenge for this, though, is even though they had made a large investment in staffing this team for outreach, one of their leaders described to me basically that for every 20 phone calls that one of these care coordinators made, only a small handful, like 2 or 3, ended up being fruitful. Now, I don't think you're ever going to have a 100% hit rate, and not every call you make is going to be productive. But when I think about the role that data plays here, some of the main challenges were that data wasn't timely or complete. A care coordinator would call a patient and the patient would say, hey, look, I just had this screen, this breast cancer screen or this colorectal cancer screen 3 weeks ago or a month ago. And the organization just didn't know about it because the claims data they were getting was lagged. So timeliness and completeness of data are one of the main challenges that I see that leaders in these organizations are constantly struggling with and trying to wrap their arms around with respect to quality performance.
All right. Question 2. Quality management relies heavily on data. What data governance practices and standardization efforts have proven effective in maintaining data accuracy, consistency, and the reliability for quality assessment and improvement purposes? Candace, did you want to kick us off?
Yeah, it might seem cliche and old and people would know it at this time, but having standard data practices when you are documenting in your electronic health record is key to having that transparency and good data to get into your system. So it starts with the organization in terms of determining what's important to get into a system like Arcadia. Is it important to get all of your colonoscopies, all of your mammograms? Most likely you want that information in there. But if there isn't, in most groups of practices or networks don't have a single EMR. So how are you deciding how that data is documented in the electronic health record to then translate over into a system like Arcadia is incredibly important. So if the data is stuck in a fax or if it's stuck in what's considered unstructured data or unstructured element in the electronic health record, you're not going to be able to have healthy data in your Arcadia system. So it really starts with workflow and best practices at the clinic or the physician documentation level to then get that great data into a system like an Arcadia that can aggregate and help you make decisions even before you know that you have to make that decision, if that makes sense. It's helping make decisions for you, and then also supporting those healthcare decisions that you're trying to tackle at a network level as well. So good data in to then aggregate over and be important into a system like Arcadia to then make those great decisions.
I want to jump in and show you Arcadia's console tool and term mapper to get at both how we're going to make sure that our clients have access to their data health in real time to kind of circle back to question one and really be able to trust that foundational data, but also show you our term mapper tool, which is going to let you account for some of those clinical nuances, I'll call it, or clinical changes that may happen over time within your EMR to ensure that all the terms that we are getting are mapping appropriately, and thus you're really able to maximize that clinical data that you have to close out as many measures as possible.
So as we think about data health and really making sure that you have a trusted data asset, I want to start with Arcadia's console tool. This is actually the tool that our internal teams used for years, and we've decided to make it available to our customers because it gives both us and yourselves real-time access to how is your data doing. So this is an example from my demo environment, which is why there's just one connector here. But it's going to tell you what is that connector, i.e. what is the data flowing into Arcadia? How is it coming into us? Where is it going? And then some important details around what has happened to this file. So has it hit the Arcadia system? Has it been brought through our engines? Has it run through our transform logic and all of our population health and data health engines and transformation logic? And then has it been exported into the downstream Arcadia applications? And I'll note when you click into this, you'll see all of the sub-files or different files underneath of this connector. And each of them are going to have their own metrics, their own delinquency dates, their own statuses, etc. What this really lets you do, though, is get a holistic picture of how your data is to date, how it's performing, and where there are potential issues and gaps.
Let's explore our next question, question 3, about quality improvement. How can healthcare leaders adopt best practices and quality improvement to enhance patient care? Josh, do you want to go ahead and kick us off?
Providers, not breaking any new ground here, they want to be using their clinical judgment and their training to deliver the best care for the patient and not have that mental burden of needing to put together the puzzle pieces around what insurance does this patient have and what, maybe wonky criteria that might be slightly different is needed to meet this measure. Leaders and administrators can help a lot. And I've seen some really successful delivery organizations take a slightly different approach where they take on the burden of analyzing all of the different contracts and membership that a provider might be interacting with. And from that, they define sort of a core set of operational measures that they hold providers accountable to. Right? And the idea here is that sort of this core set of measures, where if providers perform well against them, that performance basically flows back up into all of the individual contracts that might have their own quirks and nuances. So it takes that burden off the providers to be thinking about this day-to-day, appointment to appointment.
I want to show you one of our, what we call our Vista dashboards, which is our built-in business intelligence tool that's really going to be able to let you see those quality insights, both at the top line, maybe delivery system or payer level, but also drill them all the way down to the provider level and the member level. So you can see how is Dr. Smith doing compared to Dr. Jones, et cetera.
So I first want to take us through our quality performance dashboard. This is one of the dashboards that's pre-built within our Vista Business Intelligence Suite. And so what this is meant to be is really a starting point or kind of a home page for how is your organization, whether it's a delivery organization or a payer, how are you performing against your quality performance initiatives and targets across a period of time. On the summary dashboard here, you're going to see I have a calendar year for 2023. I'm looking at the CMS core initiative, and I'm going to look at it through the lens of the PCP name, though I could look at this through any grouper within my provider hierarchy. And this is going to show me top line information, measure by measure, what's my numerator, my denominator, the performance therein, and then various targets that you're going to set throughout the year. I'll also show you the measure impact, again, measure by measure for specific providers, as the change from target, the actual target percentage, and then what's the impact of that specific provider and measure on your overall performance for that measure for your organization.
Question 4. Many payers are unable to get supplemental data directly from EHRs for quality performance. How are payers able to avoid that governance headache? And what are the benefits of being able to access supplemental data?
Yeah, you have no choice. You have to send that data over to the payer. It's built into contracts nationwide. The ability to utilize a tool like Arcadia to set up a process to send that in whatever cadence is required by that actual payer is a major burden off the folks at the organization that are responsible for doing that, whether you're an analyst or you're working, population health director, to say the payer is asking me to send this data kind of or else. And if we can't send it through Arcadia, how would we be able to send it? So it's really important to have the ability to do that, and to do it in a structured way, and to be able to send just so much data over to the payer because they want it all. And it's important to give that to them so you are not in breach of contract.
I also want to look at this from the payer lens though, right? Because sometimes if I am the payer organization, I need a way to review that internally, but then actually I do need to go collect data from my providers. We don't have a single unified national, health record at this point. But I want to do that in a way that is as frictionless for that provider organization as possible. And so for that, we have our assess tool, which is a way to allow both a payer CDI team as well as the companion folks over at the provider or delivery organization to have one centralized list of those gaps that do still need to be filled, and a very streamlined way to submit that supplemental quality evidence. So maybe to Candace's point, they don't have to take that extra step and send files in, right? You don't have to, goodness sakes, fax them in 2023 and ask for things or any of those more archaic means.
So this is one way to set up a sample program and assess. This one's going to focus just on quality measures, of course. But fundamentally, what is this showing you? This is showing you, if I was a payer organization, all of my members, regardless of which provider they see, who have at least some amount of an open quality gap. If I'm on the delivery side of the house, this is showing me all of my members, payer agnostic, who have an open quality gap. I can see their information here in the center. I see when I log into Jesse's chart, I have all the quality measures here. This top one is non-compliant, meaning there's some amount of evidence that needs to be populated here. And so I'm going to log in. I'm going to say I can view the evidence if I wish. This will tell me the numerator or denominator events that have included them in this measure. Why are they showing up here? In this case, it's an enrollment. If there were denominator exclusions, for example, that may show up here as well. Reason codes would be custom to the organization. It's going to pre-populate the evidence that is generally accepted for this measure. So a depression screen for a depression measure, HbA1c for an A1c measure, etc. What the person working this form would do is they would go ahead and add the date of service. They're going to add the provider's name. This will, of course, look up to the Arcadia client's provider hierarchy. And then they're going to go ahead and attach that piece of evidence, whether that's a screenshot from the EMR, a PDF of a lab result, right? Whatever that looks like. They're going to go ahead and attach that. It works just like Dropbox or anything else. In this case, I'm just going to attach the Arcadia logo. I'll go ahead and hit save. And that's going to save the quality measure.
Well, clearly there are a lot of pain points surrounding quality management, but through the great examples provided by our speakers and everything we've talked about today, it is very evident that there are tools out there to help you leverage data to create a more efficient, safer, and cost-effective healthcare ecosystem. So thank you, Josh, Candace, and Christine for leading this conversation on such a valuable topic in healthcare. To see more of what Arcadia can do, you can schedule a demo. And for details, finally, on our next episode, keep an eye out on your inbox for how to register. So thanks again, everyone, for tuning into The Source. Thank you for being here. We'll see you at the next episode.